Hey there guys, this is Alex from Mental Health Thinking and I'm here to talk to you about depression. I'm a provisional psychologist practicing in southeast Queensland here, but everything I say will apply universally as well. It's the information I usually give clients to help them understand what mental health problems actually are, what kind of cycles lead to them, and how they can cut those cycles off. We've all heard bits and pieces about depression, and there's different levels to which people understand it. So there are a couple of attitudes that I just wanted to go over. One is, so they're just a bit sad, right? Get over it. Or the other one is kind of on the other end of the spectrum that if I was depressed, I'd absolutely know it. It'd be obvious. Depression is extremely debilitating. There's good evidence to show that people's neurochemistry actually changes as a result of depression. The risk of suicide goes up. The risk of dementia goes up. The risk of repeated coronary heart events go up. And the list goes on and on. According to the World Health Organization, 13% of the overall health burden internationally is psychiatric in nature. And of psychiatric conditions, depression is the costliest of all, and it is the most rapidly increasing in prevalence. Okay, so we've covered why depression isn't quite the same as sadness and why it's not quite so easy to get over it. And you'll see a bit more of that once I explain the nature of depression. So why isn't it obvious? It's because it's extremely insidious. So it's not uncommon to be referred to someone that says, oh, my wife or my doctor or someone like that thinks I'm depressed. What do you think?
So I'd ask the usual diagnostic questions, and this actually comes directly from what's called the Diagnostic and Statistical Manual, number 5, which is the current one. It's what we use to diagnose people so that we can make more informed therapy choices. So are you having problems with your sleep, low energy, diminished concentration, low appetite, or increased appetite? And this is an important one. Are you finding that the things that you used to enjoy in life, you're no longer enjoying?
Okay, I agree. I think that you might be depressed. And the reason why it's difficult for them to pick up often is that other people can see it. Other people see that there was somebody who was interested in this much stuff. And then over time, it got lower and lower and lower. Maybe you've got a friend who used to come out all the time and they used to have all these hobbies and do all that kind of thing. Whereas now they tend to say no when you invite them out to do things. You know that they spend a lot of time in their room or at home and they just don't have a lot of routines in their life. They don't have a lot that they do. These things you can generally pick up with your friends, although it might be easy for us to think, oh, they don't like me anymore. It might be that, but it also might be that they're having a hard time themselves. And maybe you could actually help them seek a bit of help. Now, for the person who becomes depressed, what they notice is that over time, and over quite a bit of time sometimes, they feel a bit down, so they decide, oh, I don't really want to go out to this, I'm not really feeling it today, so they do a bit less, and then they feel a bit more down because they've done less, so they've had less opportunities to be out and be social, and to enjoy all those normal hobbies that they used to enjoy, so then they feel more down, they do a bit less because they don't want to, and that leads them to feel more down and over, and you can see that as a spiral going down further and further to the point that they're actually really, really far away from where they originally were. And other people can see it because they didn't see them the whole way, but they see them at a flash. So what can we do to break this cycle? Well, there's actually quite a few things we can do to break it. Alright, so the first thing that you can do is get your routines back on track. So you find that when people are actually becoming depressed, that they start doing less when it comes to their routines and they'll lay in bed, they won't get up at the normal times. Now, this makes it more difficult for them to sleep, but it also means that they're not getting enough exercise, that they're not having those routines that just keep them on track. So get up, shave, shower, do all those things that you would normally do when you're feeling better, even if you don't have anywhere to go. Get outside in the morning, go and get some exercise, and that'll help you get that sunlight in your eyes. That'll actually help you wake up and help set your sleep rhythms. I'm going to do another video on sleep later, so look out for that.
So I wanted to make 2 extra points here. The first is that exercise is really important, not just to get on a regular basis and we think about going for runs and things like that, but even the smallest amount is effective in helping our situation. Sometimes it's difficult because there's some sort of physical thing that's stopping us. Even walking out to the mailbox or whatever it is that you can do, that will help you. Now, the other point that I wanted to make is that in addition to exercise, we need to be doing things that are pleasurable to us, things that we at least used to enjoy. It can be difficult sometimes with depression because we really don't get a lot of enjoyment from the things that we used to enjoy, but we can still find those things that we used to do, try to remember the things that we used to get enjoyment from, and fake it till you make it. Get out and do those things that you used to find enjoyable until they become enjoyable once more.
There are also a couple of cognitive changes that occur. Now, thinking changes to do with the types of things that you think about. The first is called cognitive bias. You tend to actually remember memories that you made when you were in the same mood state, and you also remember things that affirm the mood state you're in. So if you're feeling sad, if you're feeling depressed in this case, then it's really easy for you to remember other things that keep you feeling that way. So that keeps you in the mood state. Now, in addition to that, it's really easy for you to remember things that you came across, that you made as memories when you were feeling depressed. So this makes it seem that it could have lasted forever, that it could have been so long, because what you're remembering, even if it was only 2 weeks ago that you were feeling better, you remember all the negative things that happened in that 2 weeks, and even in other times, but it's difficult for you to remember the better times. So there's a study that I'm going to link to in the description. Now, in that study, they took people who weren't depressed, and they found that they follow a general pattern of remembering. So you get a list of words and they remember the first ones and the last ones. That's what's called primacy and recency. Now, recency, they remember the last ones because they were more recent. Primacy, they were primed to start remembering, so they remembered the first ones. But the ones in the middle missed out. Now, they did the same sort of thing with people who were depressed, and what they found with those people is that when they threw into the mix some words with a negative valence, so basically a negative connotation, then the people who were depressed remembered those words regardless of where they sat, at the end, at the start, in the middle. But the people who weren't depressed got those same lists, some of which had a negative valence, and they still remembered the same, the ones at the start and the ones at the end. So this shows the cognitive bias in research terms. Now, in everyday life, this cognitive bias looks a little bit different. It means that, let's say that you go to work and you have a day objectively that looks like it could be pretty okay. You've gone out, you've seen people, you've got your job done, but somebody looked at you a bit funny, or maybe you didn't quite do as well on one particular task as you wanted to. Now, if you've got a cognitive bias toward the negative, then it can be really easy to look back at that day and really just remember those little points that weren't quite perfect, even though the rest of the day was actually pretty good. Whereas if you talk to somebody who was in a general mood state that was okay, then they would remember bits of everything. Some things didn't go too well, but most of it was pretty good. Now, this is a cycle that people get into with themselves, because when they're remembering all the things in the past that make up how they think about themselves, they're remembering all the negative things, and they're really forgetting the positive ones. So what we can do to cut that cycle off is actually to help people bring back into the foreground some of these positive things. I've had this case where I've been talking to somebody who has lots and lots of talents. They're very musical, they're very good at lots of things, but when you ask them about something, say I asked about an album that they'd recorded, and all they could tell me was people didn't like it, there was some criticism, even though actually the majority of the comments on it were really good. And a lot of people really got a lot out of it. They sold copies. It was a really, really good effort, I think, and something that not many people have done. But what they see about it, and what makes up their view on themselves is that, oh, it wasn't very good because people said it, some people didn't really like it. So what you can do with that person is to first remind them of some of the positive things. And you can do that by just getting it out of them and asking, okay, well, just really have a think about it. Was there anything that you really liked about that? Now, it could take a little while for them to think about it. And if you're doing it with yourself, then you've really got to put your mind to it. But you'll think of something generally. Keep that into the forefront as long as you can before it slips back in and then you get the negative part again. And that's what will happen, and that's okay, it's to be expected. What you want to do is spend as much time as you can where you're focusing in the foreground on something positive before it slips back in. And to do that as an exercise where you train your brain to look at the positive side of things. So the other cognitive bias is lack of future projection. So lack of thinking about things in the future that they want to do. Now, it makes sense with depression, I guess, when you come from a point of, all right, well, they're not getting a lot of enjoyment in their life right now with the things they are doing, so why would they be thinking about and projecting into the future about the things they might like to do? But it's a lot more than that. Depression can be thought of as a slowing or a stagnation, where you imagine their thoughts as if they're going around a wheel, and in order to stretch off into the future or flick off into the future, they need enough speed that they can get that momentum. Now, when somebody is depressed and they're so stagnant, they really don't get enough momentum with their thoughts to actually flick off and to project into the future. It can actually go the other way, where somebody is what we call manic, when somebody has bipolar, and they can actually have all of these thoughts flicking off because they all have enough momentum, and you can be talking to them and they get one idea and another idea. We call it a flight of ideas, where they really just follow every idea that they have, and they just don't even worry about the ideas that they had before that they've forgotten about. But with somebody who's depressed, it's quite the opposite, where these thoughts roll around and stay either in the present and, more times than not, in the past, with that cognitive bias, thinking about the things that were negative in their life. It's no wonder then that people who are depressed think about taking their life, due to those two cognitive biases, where they think that this has always been the case because all they can remember are the bad things, no matter how long ago it was that they were actually feeling well, no matter how short a time. And they're not thinking about the future. They're not thinking about anything that they might enjoy in the future, so it seems like it's always going to be. So you can imagine that, yes. But it's also why people who are depressed and who are thinking about suicide need our help, because they're not actually accurate about it. These things won't actually last. They just seem like they will due to those two cognitive biases that we already know about. Now, all of what I've said so far combines to what I'd really say is the surface level of knowledge about depression. Now, they're things that you can apply even when you're feeling really quite well, but in terms of understanding what might lead to depression, it's really important to understand some of the major mechanisms that can be at play to actually lead to more of a vulnerability. Now, I'm going to do a video specifically about that, so I won't get into more detail here, but just recognize that what this video has been about is the surface level. It's the first buck in understanding depression and how it develops.